Mind Care SVG. Accessible mental health support in the palm of your hand. Introduction. Mind Care SVG is a mobile mental health support app that provides self-help tools, therapy resources, mood tracking, and a safe space for Vincentians struggling with anxiety, depression, or stress. It reduces stigma by providing private, accessible, culturally relevant support and connects people to professional help when needed. Why this matters in SVG. Mental health issues in SVG like depression, anxiety, and trauma are underreported due to stigma. Access to in-person therapy is limited. Only a small number of clinical psychologists serve the whole island. Many communities, for example North Windward, North Leeward, and Grenadines Islands, are geographically isolated. People can't always easily travel to Kingston for therapy. School youth and young adults are especially vulnerable, but many fear seeking help openly. Natural disasters such as hurricanes, volcanic eruption of last affair in 2021 have left trauma and stress that persist today. Problem solved. Accessibility gap. Provides mental health support tools for people who can't access or afford therapy. Stigma. Private, discreet app encourages more people to seek help without fear of judgment. Lack of early intervention. Daily mood check-ins and self-help exercises detect patterns before crisis.
Core features. Crisis button. One tap connects to SVG mental health care hotline, hospital, or emergency services. Local directory. Contact info for psychologists, counselors, and social workers in SVG. Offline. Force access. Many tools unable without data sync later when used. Mood trackers, daily prompts with emoji, sliders to log feelings, guided exercise, relaxation, breathing, journaling, and mindfulness tools. Resource library, articles, videos, and SVG specific wellness resources, disaster recovery, coping strategies. Anonymous peer support, optional moderate community board or one-to-one chat with strict privacy safeguards. Pros and cons. Pros: accessible anywhere, anytime, especially useful in rural SVG. Helps normalize mental health conversations. Encourage self-care and early interventions. Can integrate with schools, workplace, and church for outreach. Cons: not a replacement for professional therapy. Risk of over-reliance or self-diagnosis. Requires consistent moderation to prevent harmful discussion in community boards. Tech literacy gap among some older Vincentians. Target users in SVG. Youth 30 to 25, students stress about exams, unemployment, social pressure. Adults 25 to 50, workers facing financial stress, family challenges. Farmers in rural areas may struggle with isolation, disaster, trauma, alcohol misuse. Grenadines residents limits physical access to therapy services. Healthcare provider want tools to monitor and support patients remotely.